report. It's been estimated that 18% of medical errors can be blamed on poor access to patient information, and as many as 1 in 6 diagnostic tests are unnecessary duplicates for the same reason. For years now, federal and state health authorities have been working towards a national super-connected health system to be finalised within 3 years. The so-called e-health system will give everyone an identifying number that will potentially link to their healthcare records from birth to grave. But there are many details yet to be finalised, and also some concerns about how private our private information will remain. Mary Gearan reports.
You know the drill. You have one health problem, but you end up seeing a raft of specialists and health professionals, and they can't send each other a swag of x-rays, results and scripts that you've got to drag around. The risk is you lose or forget vital information along the way.
Medication isn't done on time, doses of medications may have changed and we don't know about it, blood tests have not been followed up on because the originals weren't supplied in a format that can be read.
I think it's abysmal.
Jim Morgan needs to keep a raft of scans, tests, scripts and spreadsheets he compiles himself to carry to the dozen specialists he needs to see on a regular basis. Last year, the 67-year-old needed 2 visits in short succession to a hospital in Melbourne's inner west when a burst appendix led to peritonitis, kidney failure and a heart attack on top of his diabetes and anaemia. On his second visit, he was astounded when he found himself giving the doctors more information than they could find on their own systems.
When I was admitted, they couldn't even find the file from 3 days earlier. I even had to give them the list of medications which they gave me when I left the hospital. They couldn't even give me the list that they'd given me 3 days earlier from the pharmacy. You've already got these on your computer.
Jim Morgan's GP, Mukesh Haikawal, has, like 98% of GPs, computers and software for his records. But connection and compatibility between medical providers doesn't yet exist.
Today, I can do a lot of things electronically, but I can't send it to anybody. I call it a superhighway to nowhere.
The former Australian Medical Association president is now advising the authority responsible for rolling out a new electronic healthcare system. This is how it's supposed to work. A patient would go to their healthcare provider and have a consultation or procedure. At the end of that, the medico would ask, would you like a summary of this record to be uploaded to a shared electronic record? If the patient says no, that information is supposed to stay just with that practitioner. If the patient says yes, the medico would upload the information using a 16-digit unique identifying number that's being rolled out right now for each and every one of us.
It's convenient, it will improve the quality of health care, and I think is just an absolute necessity for the future.
But the plans are still in a development stage, with many details still to be decided, and some have concerns.
Once they bring this in, we're going to be thinking twice before we go to the doctor.
A woman we'll call Suzanne wants to conceal her real name. She already feels like her family's privacy has been compromised. After her 10-year-old daughter recently made a short visit to a hospital in Sydney's western suburbs, the family received notice that the girl's details were being kept on an electronic database under the Health E-Link system being piloted in certain parts of New South Wales.
There are dangers involved in that with data security, with identity theft, issues like that. But for me, the big issue has been that they've gone over my head to get to my child.
Under Healthy Link, details of patients under 15 or over 65 are automatically kept until and unless patients opt out. Then the details are still kept but made inaccessible. Those responsible for the new national system stress it will be the patient's choice where their information is stored and, except for certain emergency situations, who can then see it.
It's the choice of the patients whether they have a shared record outside, what goes onto it, who writes to it and who can read it. They're all very, very important facets of the envisaged system of the future. Patient-controlled, patient-owned, patient's privacy paramount.
I am a bit concerned that there's a lot of people who won't, because they haven't been part of any discussion, because the risks haven't been made visible, will just sort of go, oh yeah, just yet another thing, oh who cares?
David Vale is Executive Director of the University of New South Wales Cyberspace Law and Policy Centre and on the board of the Australian Privacy Foundation. He sees merit in having shared electronic health records, but he also believes privacy concerns have not been adequately built into the IT framework and have been compromised by various interest groups.
There's also a number of other drivers, including the desire of the bureaucracy to have further and further degrees of monitoring and surveillance of various programs, the desire of medical researchers to not have to get people's permission to take part in research with their data, the desire of doctors to keep their ownership of paper records to be recognised as ownership of the other part of the data.
The key to the new system is the 16-digit unique or individual health identifier.
The shared individual electronic health record and the personal health record are in fact about the patient. The IHI is not. IHIs aren't about health. IHIs are about numbering citizens.
Dr Juanita Fernando has helped organise an umbrella group of civil libertarians, consumers and privacy campaigners with concerns about the rollout of e-health. They are the inheritors of a long-held tradition in Australia, protesting against national identifiers that were to be the ill-fated Access card a few years ago, and before that, the Australia card.
It's not the card itself that most of them fear, but the use, or rather the misuse, of a common identifying number.
According to the Health Minister, the new healthcare identifier may be accessed by a smart card or PIN, but won't have health information directly stored against it. The number is meant to simply serve as a link for authorised users.
People have a very high acceptance of the use of a Medicare number. This will obviously be different to that and not using the Medicare number, but I think when it comes to health, people have a very good understanding of why you want to keep comprehensive records and why that ultimately helps you as an individual.
As a database developer, I know that if you get the single number, you can use that to tie everything together. And so even if they're distributed around the planet, even they're in 100 different systems, if you've got one number, it becomes almost impossible to properly control the use and access and reuse, the distribution, the transmission around the world of that information.
Sometimes I think we jump a little bit too much at shadows, that this is a way to improve patient care, save a lot of time for the patients and health professionals, and reduce a lot of wasted expenditure for extra tests and repeat tests that don't need to be done.
In a submission on the issue 2 months ago, the Office of the Privacy Commissioner noted that enabling such easy and accurate linking of data could create an environment in which linking might be done excessively and sometimes without adequate justification. The Office called for greater certainty around the secondary uses of the information. Will it be illegal for instance, employers or life insurance companies to have access to this material?
Well, again, I think these are really quite ridiculous questions when we're talking about patient-controlled information of your personal health records. Putting that into an electronic form doesn't change the law related to every other situation.
The issue of secondary use of data is not covered by these provisions at this point in time. But any use of data that will be gleaned from this has to be with the patient's agreement.
It's planned that whoever accesses the records will leave electronic fingerprints. But the Minister admits many details, such as how potentially sensitive information is stored, is yet to be thrashed out. Juanita Fernando is frustrated by a process that has seen only invited advocacy groups, including hers, involved in the development of the system.
We need to hear a consumer voice, and there's no consumer voice.
I think trying to have the public intimately involved with every piece of, technical advice that we're getting on how the different pharmacy information and GP information, hospital information will link up is probably beyond the interests of most people. So I don't think that sort of discussion has to be had publicly.
They have not taken people into their confidence, and they haven't put solving the privacy risks for real people in a way that is persuasive and reliable. They haven't put that at the heart of the process when it should have been.
The paramount building block is confidentiality. If you don't have that, people won't square up with you, and you don't get the full information.
For Jim Morgan, e-health and its promises of efficiency can't come fast enough.
Yes, I'd prefer other people didn't get access to it, but what on earth are they going to do with it anyway?